use the babies as alligator bait, but you go to them as your gynecologist today. And then I've talked about this previously, but in 2011, I had a stillbirth. At 41 weeks pregnant, I was overdue. Went to the hospital on Thanksgiving Day. My physician did not want to come in. They sent me home, told me my water never broke. Mind you, this is my first pregnancy. I know what the hell happened to me. And they sent me home. Every day following for that entire week, I went to see the doctor to check to see if I was dilating. And they kept telling me, no, you're not dilating. My child ended up basically suffocating because there was no more amniotic fluid. This is something that commonly happens to my body every time that I'm pregnant, which I find is interesting. I was able to settle with the hospital for negligence, but the amount of money would never bring back my child. Fast forward, Massachusetts was the most amazing place to give birth to my son. My C-section scars, my doctor that I had after the stillbirth was very, very careful. Placed me as a high-risk pregnancy, made sure he was very attentive, delivered my son safely, and all was well. C-section scar, chef's kiss. Fast forward 10 years later, I was pregnant with my beautiful daughter, now Luna. Beginning of the pregnancy, rocky. I was less than maybe 4 weeks pregnant when my HCG levels were going up, so I knew I was having a girl. Went to the hospital in Florida because I was spotting. They told me I was having a miscarriage, sent me home, and went about my way. You want to talk about healthcare in other countries? I ended up finding a gynecologist who I can actually link him on this video in Guatemala, who made sure he was going to find out what was going on with me. From doctors believing that it was a potential tumor cell because of the high HCG levels and not being able to see Luna in the ultrasound. Time progressed, they were able to find her. Guatemala made sure they found their best ultrasonographers. And eventually, as time progressed, Luna was showing on the video and she was healthy. And now you see I have a healthy, happy girl. However, I went back to Florida to give birth. The doctors were well aware that I was a high-risk pregnancy. I was given 2 ultrasounds. Each lasted less than a minute. And I could tell majority of the time I'm thinking that maybe it cost them or something to degree. Like, why are you doing an ultrasound that fast? They take the baby's measurement, they measure the amniotic fluid, and literally rush through their patients. It's worse than McDonald's. It's like a fast food restaurant. During that second ultrasound, the doctor tells me, hey, we're a little concerned your amniotic fluid is low. You're having a baby today. That was at 37 weeks pregnant. I knew it was going to happen. And I kept telling them, look, we need to do this ultrasound, and they kept pushing it off. He clearly got it at the end. Fast forward, I have never experienced so much pain physically after a C-section. They did not give me pain medication. I was having issues with heart palpitations. I was so scared to lay down because my heart rate was